I'm gonna briefly go through the crucial applications of virtual and augmented reality. But to begin with, we need to understand till what extent these technologies have already penetrated into our healthcare. So, if you know, the desire to actually modulate an external environment where you can do absolutely anything has always been a motivation for any innovator, and that has happened through the digital platform. So especially in virtual reality and the augmented reality platforms, they are being primarily used in two aspects, that is education and training. And the training can be on both parts, doctors and also patients. As you can see in these few images, these doctors have made a beautiful augmented reality presentation of a likely presence of the brain tumor and its surrounding vascularity, where the doctor is probably trying to explain to the patient the complexity of the procedure that will probably be involved. To the other side, if you're considering training, then this particular technology can be very useful in actually helping you guide to do certain specific steps, as I will bring about in the next video. But it is important to differentiate virtual reality from augmented reality and mixed reality. So augmented reality is basically just digital overlay of information, which can be just your, say, a digital overlay of your time or any other format. But virtual reality is where the environment is completely closed and you're totally immersed into it, and it creates a new digital environment for you inside the device. Mixed is the combination of both, where you still perceive your actual background and environment, and yet the digital environment is, I would say, projected onto it. And Microsoft HoloLens is an excellent example for the same. So I just wanted to highlight this. This is one of the firm in Israel, which they wanted to develop a training tool for orthopedic spine surgeons, where they found the difficulty that the surgeon had to actually look at the screens and then try to focus back onto the surgical site. So what they came up with is an augmented reality, mixed reality platform. And as you can see here, the doctor basically is able to visualize the contents of the whatever the screen is about to display in augmented reality fashion right in front of him in a form of a multiple screens. Now this is so useful, and probably in the future we will see our wet labs going into the same fashion, including cataract and corneal transplants. The existing platforms are actually, in ophthalmology, using virtual reality are basically in the perimetry. And there are many devices in US and in Israel which have been launched to this date, where they can actually perform a complete full thresholding, and they are very close to actually replace the algorithms performed by current gold standards. But the time is still a little far away. It needs a lot of correction, especially in the follow-up algorithms. I think Mr. Anand is here. He has also worked extensively in their Remedio platform for a similar device. So I would share our story, where how we came up with this idea of developing OM, which is our vision, which is our virtual reality perimetry tool. So as you can see, the vision assessment today involves significant high cost, and especially when you go to the peripheries, you're going to face the problem of shifting the costly infrastructure to the peripheral centers and the deficit of trained personnel. So how do you overcome this? To add to that, HVF has its own problems. As John very well knows about this, the patients often complain of fatigue, back pain, neck pain, loss of concentration, and long hours to perform this test. So the question in front of us was, can we build a visual field test suitable for mass screening in remote locations and also solve the problems of HVF, and try and build a device which is of equal standards and quality? So there the concept of OM was actually born. And we aimed at developing a comfortable, quicker, easier device than HVF, which is more affordable, portable, reliable, and it is compatible across platforms compared to HVF. As we already had the virtual reality technology in-house, to create a immersive experience in the form of vision perimetry is very easy. And I think John would agree to this, that this is actually shown wondrous results. And I would actually like to know his comments soon after the talk on his periscreener experience.
Yes, yes.
So what we came across was to develop a software which will run on multiple platforms and multiple platforms of virtual reality headsets, which actually gives you a component of universality in this. So talking of it, when we started developing it, we realized that there are excellent applications involved in this, even beyond just visual field assessment. Like it can be a training tool for the conventional field analyzers. It can be overall quantitative assessment tool, especially in the comprehensive examination in the primary centered fields. So when we developed it with the background of trying to develop a supra-thresholding algorithm. And this procedure was basically based on a differential light sensitivity test. And to develop this, we had to validate the background luminance of the LED headset of the virtual reality headset. And there are various scales which of the Unity game engine, which allows you to actually pinpoint the correct duration of the stimulus, ranging from 0 decibel to 50 decibels, and convert it to your validated point. So we followed a staircase approach, and we did a preliminary trial of a few patients where we conducted both the tests of Humphrey's visual field and Ohm on them. And we came up with certain threshold points which were used as guide points to develop our main algorithm in the Ohm. So the 20 decibel was considered normal, and anything below 7.5 decibels was considered to have an absolute scotoma. Anything above that, around 7.5 decibels, was a relative scotoma. So the procedure was very simple. It involves installing the app on your smartphone, and the test usually happens on the phone. The technician guides the patient through it, and the results are generated as a grayscale map, including the other parameters as they are mentioned: the foveal threshold, false positive timings, and also the reaction times. There is a three-step process where first the visual acuity is tested, and if it is adequate up to 20/40, then the test actually goes ahead to do foveal thresholding. And then the foveal thresholding is basically tested with the presence of a red dot. Again, the illumination was validated for the same, and then the visual field screening happens. This is a short video of the procedure of the same.
Ohm is a quick and comfortable visual field test for the patients. Show them the device and inform them that they will be wearing it to perform the test. Every Ohm kit comes with a test guide. Use that to explain to the patient the controls and what they need to do during the test. The test is in 3 stages: visual acuity test, fovea thresholding, and visual field examination. After you have explained the Ohm test to the patient, you can use the Bifrost app to set up a test. Once set up, start the Ohm app on your VR headset after making sure brightness, Wi-Fi, and battery are set as required. Provide a disposable hygiene mask for the patient to wear during the test. Wipe the lenses on the headset. Help the patient wear the headset and hand over the controller. Proceed with the test control using Bifrost app. Before the start of each stage, audio and text instructions will pop up for you to remind the patient of what they need to do. When the patient is ready, click Continue to go ahead with the test. You may use the screenshot feature to guide the patient in case of any confusion. Once all stages are complete, the result of the test will be displayed on the mobile app. You may help the patient remove the headset now.
Following this, we performed a clinical validation trial where we used OM on 158 patients. And so in this, we actually incorporated 76 eyes of patients which were glaucomatous and 82 which were normal with no history on. All these patients underwent initial clinical examinations with the doctor, where they were actually labeled into either glaucomatous optic neuropathy group or in the normal category. And the OM test was done in all of these patients along with HVF. So the HVF reports, again, the Anderson criteria was used, and the data was labeled if having any hemifield involvement, either superior, inferior, or both. And primarily, the clinical examination performed by the doctor was the gold standard over here. And the HVF was not considered as the gold standard. The primary examination by the doctor for the optic disc and the RNFL findings, including the visual function, the vision perimetry, was considered as the gold standard. Apart from this, the ophthalmologist also labeled if there was any anomalies in the optic disc and labeled them according to the quadrant and the hemifield involved. So there were various different criteria, but overall, after going through the field test, we came to the point that the criteria of minimum 3 depressed points in a cluster of the absolute scotoma gave the best sensitivity specificity, and this was defined as the criteria to go ahead with to define as a a defect in the visual field. So the results were classified in 2 scenarios: the presence or absence of abnormal visual field, where we could find that compared to HVF, OM fared fairly well in sensitivity and specificity in the initial stages. And in the scenario 2, where the hemifield diagnosis was considered, the sensitivity specificity was around 83 to 84%, which is also fairly good considered to the standard of the HVFs over here. Overall, these are the reports. So the advantage of how we were able to capture the fundus camera photos along with the OM is something I will come up to later. But these are some of the patients in the validation trial where this is the patient with normal visual fields, and this is with primary open angle glaucoma, where it was able to identify the hemifield defect. Now, the challenges involved in developing this technology were in its place, but the challenges to actually excel the performance at the grassroots level, as Dr. Padmaja pointed it out in the pyramid model, were new to us, and it required an exercise. So the problems in report accuracy, problems in connectivity, training of the staff, fundus cameras for disc photographs, and all of this had to come in a sync to solve all of these problems, which happened over a period of time. Luckily, once the validation trial was over, we were able to put the OM into the fields in our peripheral vision centers, and we are on daily basis. Before the COVID lockdown, we were capturing the follow-ups of glaucoma patients and even the normal patients using OM and fundus capturing devices at our peripheral centers. And all of these were actually uploaded on one of our unified layer of cloud or data, you can call, which is actually a uniform platform for many devices across the network. And it is a middle layer between your electronic medical record systems and the actual device, which actually hastens the process and also aids you in capturing the right data with great accuracy, which sets the stage for artificial intelligence based analysis. So the OM software continuously keeps on learning, and it gives you the final report back onto your the app on the phone. Interestingly, we have also found that since being a basic visual field diagnostic test, it also showed results in neurological disorders, especially in NAION. And we expect that these results will be seen in further neurological diseases. And another study is actually on the way to test the same. So the possible uses could be in traumatic head injury or screening visual fields. And the overall experience has been great. And the patients especially commented on how comfortable and fast it was, and how they no longer had to travel from far and actually could do it from home if a technician could bring the device there. And many of the patients were happy that they didn't have to sit in the dark room for long, and it was very fast. Overall, its advantages are numerous, especially being cross-platform compatible and affordable. Recently, we won an award for NASCOM Tech for Good Healthcare Prize 2019 for the same, with AT&T as our partner, which in which OM actually proved to be 10 times faster and 20 times less expensive than HVF. So this is the main team, Juhi Bhaskar and Mohammad Amir Ali. They are the leads in this, and Raghu is our lead of the Innovation Center. And the glaucoma department, under the guidance of Dr. GC, Dr. Sirisha, and Dr. Nikhil, have done a splendid job over here. Coming to augmented reality and mixed reality in ophthalmology. So augmented reality has been used extensively, especially in healthcare till now. You can see some of these apps in, especially these are actually videos. I've given screenshots so that you can actually check it out later. Augmented reality can actually be used to give a very new form of an education. Like in this place, a student is trying to see by using a t-shirt as a cue, that what are the state of his internal organs. Those are not his real organs, but it is just an educative tool. Then pharma companies are using augmented reality to actually educate the patients better about their drugs using augmented reality animations. Nurses are using it to find the veins faster using the AcuVein AV400 app. And finally, the Microsoft HoloLens, which has been one of the great innovations by Microsoft to take the education to the next step. An interesting the innovation by one of the a group called eMacula, where they actually filed a patent for a dual system of contact lens and glasses, where the glasses were able to perform a digital overlay over the contact lens. And imagine you would see a view like this. This is something definitely like out of a sci-fi movie. And these technologies are now on the brink, and it will happen soon that such paired devices will come into picture. This will definitely jeopardize the smartphone market, but it's interesting technology to look into. So the wheels of the augmented and virtual reality machine journey has been mainly because of our two engineers, Santosh and Shankar. Santosh being the team lead, and they have worked really hard in bringing up these innovations. Here I'm trying to use their innovations, especially the next one, which I'm trying to show, which is the EVA app. So the EVA was basically based on Microsoft HoloLens, and we tried to generate beautiful anatomical models and a new learning experience using it. I think I would rather show you a video about it to explain.
From the very first depiction of eye anatomy by Hippocrates and Galen, we've come a long way now. And the next evolution in learning, the revolution of augmented reality-assisted learning, is here. Augmented reality adds a whole new dimension to teaching and learning. It allows you to project information of three-dimensional models in space and learn in a new perspective. Human eye anatomy can be studied in greater detail, with the learning made more experiential. This enables us to holistically study the eyeball, ocular adnexa, and the visual pathway. It also allows us to split individual parts to their component layers, as in the case of the cornea, and also allows us to pick individual cells to study them in detail.
think of cornea, how it keeps its clarity and compactness. There are many factors which contribute to this, but one of the most important factor is endothelial pump. And today, augmented reality, you can walk into the endothelial cells, experience the pump yourself, and this is what I call a transformational learning.
At LV Prasad Eye Institute, our vision is to reconcile excellence with equity. As we incorporate more and more technological tools, we hope that our education and research efforts can be significantly enhanced both in terms of quantity as well as quality.
So we're really excited about our partnership with the Vineeth Prasad Eye Institute. And now we're taking this partnership to the new level, to a next level, by bringing in mixed reality technology with HoloLens and seeing how we can revolutionize the field of medical education, something which is very rich, where students and faculty can actually interact in a kind of a 3D mixed reality environment, literally to the extent that you can go inside the eye and see it from within. The future and the potential is limitless.
My company, Vineeth, is a leading edge innovation and engineering services provider globally. We collaborated with LV Prasad Eye Institute to produce some of the best social innovations in eye care. We believe this collaboration with LV Prasad Eye Institute will continue to make sure we produce education and learning tools for future generations. The process started with an artist rendering the images of the models and the 3D modeling of the same. It is exciting to see the way in which concepts can be understood in a new dimension. The models were coded onto the device and projected through the HoloLens. It was a multidisciplinary collaboration that brought together individuals from different disciplines to build an amazing solution of the holo eye anatomy.
Today, being a surgical and medical teacher is very exciting and a great fun, primarily because of these new technologies which create a multi-dimensional experience for learning.
It was a fantastic experience. I could visualize whole of the eye in a three-dimensional manner. What we usually learn on the screen and in textbooks is a 2D view. We are not able to relate each other, but in that view, I could relate different structures, different eye models with each other. What you visualize is what you memorize. I never thought I'll say this, but I'm ready to learn anatomy all over again.
So that was just a brief overview of things. So based on the same platform, I, along with Santosh, built a module for corneal infections. So I'll show you how you will be actually seeing it inside the device. So if you see, so once you log into it, you can actually see the virtual space. So this is black because I rendered it for you all so that you can actually experience what is the, how is the view, but your background will be replaced by the black background here, whatever, in whichever room you are. So so here is the human visual system model, which Dr. Vipin was talking about. And it has really great 3D animations where it will actually go inside the eye. You can actually study different parts of the eye. Just click it and it will separate into its multiple components, as they will show right now. So the moment you click it, it will get separated into its anatomical parts. You can select each one of it as you want, and then there are modules inside it where some of the modules are still being made, some are done. So I worked on the cornea module, and being really motivated by the management of infections, I actually devised the corneal infection module. And so the whole idea was to bring the entire experience together. Santosh designed beautiful models of microbiological organisms like Acanthamoeba, Aspergillus, HSV virus, Microsporidia, and even Pythium. And so this was a platform to study not just clinical photos, it was the platform to study microbiology of corneal infections, their pathology. You can actually toggle through different presentations. We actually made the whole thing in a way which will be very intuitive for a person to learn. So this is just Acanthamoeba keratitis, where you can learn it. If you want to see the model, you can go close to it, see the inner ectocyst, outer wrinkled ectocyst. The next plan was to give an audio overlay, which is still in process, and you can actually put in some really beautiful animations like this. So how the organism goes through different layers of the cornea, and it reaches to the stroma but never crosses the Descemet's membrane. And so you can study the microbiology, and apart from that, you can also study different investigations like confocal microscopy and surgeries. So I incorporated videos in the same thing. So the entire gamut of how to manage acanthamoeba infections came under one single roof. So whatever you would probably spend hours in actually studying and understanding, you would gain the same very fast in a matter of like 10-15 minutes. Some of the models generated by Santosh on Pseudomonas, Aspergillus, and also Pythium. So in this way, we made this model. So we realized that this was actually dependent on the virtual reality headset. And then Santosh came up with the app where actually you put the same models in a phone, and you can study the same content. This is on the phone. This is in his room where he is projecting the same eye anatomy model and the same content. So it's become very usable now, user friendly, and it's a very new way of learning. Another very good way of learning was introduced by the same team, called the futuristic digital book, and how you can make learning more comprehensive. How can you include more surgical videos and probably talks along with it, and also clinical pearls, and then the futuristic ebook. So not just book, but it involves uh, clinical pearls, which are actually made by the consultants and the fellows. There are grand rounds in it where you can actually zoom in the videos.
Good morning, everyone. On behalf of Justice Ramanama Children's Eye Care Center, Kar Campus, Elvi Prasad Eye Institute, Hyderabad.
You can actually flip through different features, different diseases, different pearls. Every, I would say, space is actually interactive. And as you can see, he will demonstrate the same animation again. It's very intuitive and very, very nice to see these platforms emerge, because they make your learning really fast and really unique at a different level. Coming to one of the final ventures in augmented reality, I would say this is the most recent one, where as augmented reality, is been a very good part of even shopping malls and online shopping. So we tried our chance at how to customize spectacles at your fingertips using augmented reality. So basically, Santosh and Shankar developed a customized fitment advisory, and using the augmented reality platform, they could actually generate an entire, I would say, library of different models of frames based on the IPD and the size of the user, and it makes shopping spectacles extremely easy. It's basically uses a swipe feature like the one in Tinder, where you can actually select the frames by just swiping right and reject them by left, especially made available for people who actually are not well educated, coming from far off. For them, it's a very nice thing. Lastly, I would like to end with, because of our experience of developing these animations, we were actually able to succeed in developing really foolproof ophthalmology anatomically accurate animation models. And what are the uses of them? Multifold. It can lead to smarter presentations for all subspecialties, and they are useful for you to demonstrate surgical steps. They will also aid you in explaining novel techniques or even new drugs, their mechanisms, or molecular cellular level processes. but major hurdles faced by clinicians are how to explain the concept to the graphics designer, how to take the time to build an anatomically accurate model and then validate it, and then the difference between the expectations and the cost. This is one of the animations we developed using the same models, but a video format for DMEC surgery to invert a DMEC fold. And this was all done in the animation lab. Thank you.